that we are here today with Dr. Anthony Fauci and with, I'm going to call her Dr. Becky Pringle too, because if you've taught science in public schools for 30 years or 31 years, I think you've earned your doctorate in a real way. I'm the only non-scientist here. I'm a social studies teacher and a lawyer. But we're here today, the president of the NEA and the president of the AFT and Dr. Fauci, for all the obvious reasons. And for those who were here in the summer, Dr. Fauci was kind enough to be with us for another fireside chat, also in a remote way. But, you know, in the summer, we had a very different circumstance than we have right now. In the summer, in July, a lot of schools were on summer break. The COVID disease, looked like in many places that we had been tackling it, and vaccines were still in trials. And Dr. Fauci spent a long time talking to us about masks and the changes in terms of masking and why and where the disease was and what he thought we needed to do. But frankly, we also had an administration, he may not be able to say it, but I can, that wouldn't give us the resources, wouldn't give us the guidance, downplayed the disease. And frankly, we had a lot of mistrust and still a lot of fear. Fast forward to right now, we have an administration, and by the way, Dr. Fauci has worked for every single one of them since Ronald Reagan. We have an administration who believes in science, who knows that we need real guidance to reopen schools safely, and who believes in the resources to get us there. And we have a chief doctor in the United States of America who actually has been really studying COVID and pushing and getting those vaccines out. And we're really honored that we can hear from him what he sees and what he thinks based upon the data and based upon the science. I couldn't think of a better person to have to moderate this conversation with you, Dr. Fauci, than my friend and my pal and the indefatigable new leader of the NEA, the largest union in America. And so I know since you have, a time constraint, I'm going to turn it over to Becky and we're going to go right to questions. But just let me one more time say thank you for your time.
Thank you, Randy.
Dr. Fauci, we had tens of thousands of responses, questions. But I have to tell you, by far, the most of our members, and I can say this, I know for AFT too, Randy, just wanted to say thank you for your unapologetic advocacy on behalf of American people all over this country. So I just wanted to convey that thank you. So let's get right to the questions. I just want you to know I turned on the fire just for you so that we can have a fireside chat.
Very good. Thank you, Becky.
You are so welcome. I know you feel really warm because we all love you. I just want to say that. We have a question from Kayleen from our Nebraska State Education Association. And she, of course, like so many others, are concerned about this new strain of the virus. She said, given that the new virus strains appear to be more easily transmitted, are there types of masks that are better than others? She wants to know whether or not this new strain is something that we should be concerned with in terms of how we are protecting ourselves and mitigation strategies. All of that. Are there any special considerations that we should be taking?
Well, Becky, that's a great question because everyone is asking it right now. Yes, the strain that we have a lot of information on is one that has dominated in the UK. It's referred to as a B117 strain. You don't want to call it the UK strain. That adds a bit of stigma to the UK when it wasn't their fault that the virus happened to evolve there. It does have a greater degree of transmissibility compared to the others, and the most recent data indicate from the UK that it appears to be a bit more virulent in the sense of potentially causing more serious disease. That strain is already in the United States. There have been well over 300 cases in over 28 states. It appears now that the vaccine that we are using in the United States seems to do pretty well against this, in the sense of there's no reason to believe that we won't be protected against that. And some recent data from another company using another vaccine that they tested in the UK indicates that the kind of concept that we use with a vaccine seems to be good. This is not necessarily the case with the mutant that's in South Africa, which is really a bit more problematic, in the sense of that if you examine in the test tube, it diminishes considerably the efficacy of the vaccine-induced antibodies. But that's only in the test tube. What we're going to be finding out soon, literally likely within the next couple of days, is whether or not that the vaccines that are used, that we use, or that are equivalent to the ones we use, are actually effective or not. And the early indications from a trial that literally just came out from its press announcement this afternoon at 4:00 from a company called Novavax indicates that a vaccine that looks really good against what we're dealing with now doesn't look that good, in the sense of not 90-95%. It's somewhere down around 60% for non-HIV infected individuals and about 49% for HIV infected individuals. Bottom line of that somewhat too long an explanation is that we have to keep an eye out on this, and we have to be able, and we are already doing it, of being able to modify for the future, not for tomorrow or the next day, but modify for the future the vaccine, so that maybe we will have to give someone a boost to cover these new variants. But to your question that was just posed to me, is that if it is in fact, which it is, somewhat more transmissible, you just need to double down a bit more on your prevention modalities. That's uniformly wearing a mask, keeping physical distance, avoiding congregate settings, particularly indoors, and obviously wearing a mask indoor, and washing your hands as often as you possibly can. The CDC has not changed any of its recommendations about mask wearing, in the sense of saying wear 2 masks or do an N95. They haven't gone there. They have just said everybody should wear a mask. There are many people who feel, if you really want to have an extra little bit of protection, maybe I should put 2 masks on. There's nothing wrong with that, but there's no data that indicates that that is going to make a difference. And that's the reason why the CDC has not changed the recommendation. What they might do, Becky, is that they might take a look at data that's accumulating, and they might change their recommendation. But the bottom line is, the minimal thing you need to do is always wear a mask under circumstances when you're in settings where you're with people or you're in congregate settings. You are where you are right now, nobody around, no problem wearing a mask.
Thank you. Randy?
But we always have them with us in the event somebody walks in the door or things like that. As Dr. Fauci is getting his. So I'm going to kind of flip, because I had a vaccine question too, but I think the question that is on everybody's mind, Dr. Fauci, parents, students, our members, I've been on the phone a lot with the White House today, with Chicago today, Philadelphia, where I'm going with this question. And This is from Ron Hobart from United Teachers of Wichita. And so what he's asking is, and he's asking it this way, how can we both protect staff and students who are in face-to-face education settings as we move into the more critical stages of the pandemic in the next 4 months? So, but it's really the question of not just the variant, but, what do we do now? How do we both stand up in school learning for, K-8 and keep people protected?
Well, as you probably know, and because you said you were talking to the White House today, that I'm sure they spoke to you similar to what I'll mention very briefly right now, Randy, that, the president is taking very seriously the issue, both from the student standpoint and from the teacher standpoint. And he really wants to and believes that the schools need to reopen in the next 100 days, essentially all the K-8 schools within 100 days. That's the goal. That may not happen because there may be mitigating circumstances. But what he really wants to do is everything within his power to help get to that. And you know about the rescue plan, because the American Rescue Plan is something that hopefully will provide the resources for masking, for better ventilation, for whatever resources the schools might need to protect the students and the teachers. In addition, to get teachers vaccinated as quickly as we possibly can. So not only will you have the public health measures of masking, better ventilation, better spacing, but if we can get them vaccinated as quickly as possible, that would hopefully get to the goal that we all want. Namely, we want to get the children back to school for the good of the children and for the good of the parents, and in many respects for the good of the teachers, who want as much as anybody to get the children back to school.
Thank you, Dr. Fauci. And as I turn it over to Becky, I know for our audience, when Dr. Fauci talks about teachers, we talked about this last time, it's teachers, it's food service workers, it's the bus drivers. And so, I just want to make sure that for our audience, we know we're talking about all educators and school staff.
Well, Randy, thank you. I really do appreciate that. When I say teachers, I do mean that, but it is important to be explicit about it. I'm talking about the team that educates the children, and it's a team. And by the way, as you know, I have a personal interest in this because my daughter is teaching science in the 3rd grade in New Orleans. So she's been a teacher down there for 5 or 6 years. So when you talk about the things that are important to you, I hear them also on phone calls daily with my daughter.
Thank you, Doctor. Becky.
That is really great to hear. I did not know that, Dr. Fauci. I'm learning new things about you every single day.
Right.
That's incredible. And thank you for acknowledging the team that it takes to educate all of our students. So we have another question from one of our members, and we've heard you talk a lot about this, the fact that COVID-19 and honestly all of the crises that it spawned has impacted our Black and Brown and indigenous communities, students and communities at a disproportionate rate. And their concern is whether or not we have the infrastructure to provide the vaccines that we know we need, particularly in these communities, and whether they'll be equitable or not. Can you talk a little bit about the steps that you are talking about and the administration is talking about to overcome these real concerns?
Yes. Again, I like the questions because now we do have some answers for them. So part of the 101-page strategic plan that the president has announced last week in the White House, I was with him 5 feet from him when he made that announcement, includes exactly what you're talking about how do we get access to whatever healthcare, testing, vaccines to people who are mostly brown and Black people who are in areas of poor access. We have a special person who is a very talented physician named Marcella Nunez Smith, whose job is as the equity officer. So she spends full time in trying to figure out as well as implement what we're going to do. Open up community vaccine centers, make sure that you have mobile units to get to the areas that are underserved. Make sure we enhance the healthcare delivery capability in those areas. So we are acutely aware, for absolutely certain, of the disparity, not only in the incidence of getting infected, but also the negative consequences once you get infected. And the data are sobering and in many respects painful. When you look at the hospitalizations per 100,000 among brown and Black people compared to the general population or just white individuals, you can see a tremendous disparity in incidence of infection, hospitalizations, and deaths. And we've got to overcome that. Some things we can handle right now, the way you're referring to. We can get into the community and make sure they have an equity with regard to the vaccine. But as I've said, and Randy knows this because I mentioned it last time, if this outbreak does anything, it sheds a very bright light on this social determinants of health, which really make Black and brown people at a major disadvantage when you get a disease like this. When we get control of this disease, the social determinants of health will still be there. So we've got to make a multi-decade commitment to equalize that so that you have no more of a situation where you have this extraordinary disparity in almost every disease, HIV, AIDS, underlying conditions, COVID-19, always at a disadvantage to the minority population.
Thank you, Dr. Fauci. And I really appreciate the way you laid that out. I get a lot of questions about, educators are asking for money, not only to return to school safely, but equitably. And a lot of people say, well, we shouldn't be talking about that right now. We just need to focus on this. And what you just said is so important to say, that it is in this moment that we need to not only be resolving these problems for this pandemic, but for the larger issue of all of the social systems compounding to continue these inequities. So I appreciate you framing it that way. Thank you.
Thank you, Becky. And you know what? It's why, in some ways, all four of these crises, the COVID crises, the economic crises, the racial justice crisis, and the climate crisis, are all intersecting and all making each other worse. And if we don't deal with healthcare as a right, and if we don't deal with climate in these kind of ways, we may solve the immediate pandemic, but not the long-term issues that affect America. So thank you, Dr. Fauci. I'm going to go back to one of the questions about vaccines. There's a ton of them, like when are we going to get more, and and on and on. But Beth Berger, also, we got a lot of questions from Kansas right now, from Kansas City, Kansas, asked the following: school employees are getting the vaccine, but not our families because they do not qualify in the 1B tier. So the question is, can someone still transmit COVID even if the person has been vaccinated?
The answer is theoretically yes, and let me explain why. And we're going to learn more about that and be able to give you a more definitive scientific answer. But the primary endpoint of the two trials, the Moderna trial and the Pfizer trial, was preventing clinically recognizable disease, namely symptoms associated with the infection. That's where you got the 94 to 95% efficacy for both of those vaccines. But what we do not know, and it is feasible, conceivable, is that you could be vaccinated, which would protect you against symptomatic disease, but you could also get infected and not know it because the vaccine is protecting you from getting symptoms. So you could theoretically, and in reality, be infected, have virus in your nasopharynx, not know it because the vaccine is preventing you from getting symptoms, and then you could inadvertently or innocently transmit the infection by not wearing a mask, which is the reason why we say something that many people believe is paradoxical, but it isn't. Why do I need to wear a mask if I've already been vaccinated? It's for that particular reason. Soon, I hope in the next few months, we're going to be doing quantitative determination of the amount of virus in the nasopharynx of someone who has no symptoms but's infected and was vaccinated versus someone who has no symptoms, is infected, but was not vaccinated. And what I expect to find, but you got to do the experiment. You can't, guess because you think you're very smart. You've got to do the experiment. And I believe we'll see that the level of virus in people who've been vaccinated but are infected without symptoms likely will be very low, which would mean we'll learn that it's unlikely that they will infect someone else. But until we know that, wear the mask. I've been vaccinated. I got my booster last week. But when you see me out, when I'm not talking to a screen, but with people, this is what I do, even though I'm so-called protected from clinical disease.
Thank you, doctor. And I think that's part of the reason why so many of us are now pushing the concept of the rapid testing so that you can see asymptomatic spread in different places, including in schools.
I totally agree with you. And I'm glad you brought it up, Randy, because what we really do need to, and maybe someone's going to ask a question about that, we need to make available, and this is relevant to the school setting and the educational team. And that is, we have now rapid antigen tests that do not have the exquisite sensitivity of a PCR, but they're sensitive, particularly if you use them a fair amount. They're specific, they're cheap, you can do it at home, you can do it yourself, and you could know if you intermittently survey the students, the teachers, the staff, you can get a feel of what the penetrance of infection is. So even when you want to know exactly if someone is infected, it's not as good as the PCR. But if you want to get a good rhythm of understanding what's going on in the school, what's going on in the environment, those tests, trust me, in a period of months and hopefully sooner, are going to be used much more readily.
And so let me turn it over to Becky, but that's why I assume we're seeing the CDC say, and you say, Dr. Fauci, and President Biden say, we need the CDC guidance, we need these rapid tests, we need to make sure we have the accommodations and the vaccines. I hear all four of those things a lot.
Absolutely. Absolutely.
Sorry, Becky.
No, that's okay. And I'll add my voice. Dr. Fauci, please keep saying that. Please keep emphasizing that we have to continue to take those mitigation strategies, even as we have more and more people vaccinated. That is so incredibly important. And I have another question from Alicia Bada from North Dakota United. And we still have people, Dr. Fauci, who are concerned about the vaccine itself. Although when you see lines in Florida and the fact that some people are still waiting to get a call back to schedule an appointment to get a vaccine, I'm not sure that people are worried, but we do still have some people that are worried about the long-term side effects. Can you talk a little bit about that?
Yeah, thanks, Becky. Great question. So if you look at the history of vaccines, you know that virtually all, you never say all and you never say never, but virtually all of the long-term effects of a vaccine that are adverse events occur between maybe 15 and 30 days after you get the dose. Maybe 45 days at the most. When you get a vaccine that is allowed by the FDA, such as with the emergency use authorization, a little recognized fact that we've spoke about, but it kind of got lost in the shuffle, is that you have to wait 60 days from the time half the people got their last dose and observe safety before you can say, now we can have the vaccine be used on the public. So if not most, but almost all of the so-called long-term effects occur within 45 days, if you wait 60 days, you've gone beyond that. So the chances of there being a long-term adverse event are vanishingly small. And every time the FDA gives an EUA or a license, that you make sure that before you allow it to go into people outside of the clinical trial, you wait those 2 months.
Wow. So I know we have, and for everyone who's watching, as you can see, Dr. Fauci is in high demand these days, and we thank God, and thank God he's out there unbridled as a scientist, and we need that. But that also means that we only have a few more minutes, and we only have about time for about two more questions. So I'll ask one, and then Becky will, and Becky will close up. And this, this may sound political, Dr. Fauci. We don't mean it to be, but we saw this experience in the fall, and then we're now really seeing this experience, unfortunately now, which is, this is a question from Florida, which says that basically, the governor of Florida is disregarding CDC recommendations from, who should be priority for the vaccine, and what the mitigation factors should be in schools. And so the question was really, what do we do?
That's a tough question, Randy. I'm not sure what you can do. I know that months ago, Dr. Birx and I, once a week, would be on a phone call with the Miami mayors, the mayors of Miami and the mayors of Dade County. And they often had difficulty because they wanted to do things or not wanted to do things, and were sometimes in conflict with the governor. I don't know how I can resolve that because I don't have any power to do that. So I'm afraid I'm not going to be much help there, except try to have the people locally do whatever they can to do the right thing in protecting their citizens.
Thank you. I think that, and then I'm going to turn it over to Becky for the last question and also to close. I think that the more we can have clear guidance out there, then we also can be a moral army to actually try to make sure that it gets enforced.
Right. I agree.
So, Dr. Fauci, I know but we only have a few minutes. So I actually want to open this time up to you to just share any framing final thoughts that you have about where we are and where we are now, and where we can and must go, and what we as educators and leaders within two very powerful unions can best do to ensure that our president and all of the folks he has surrounding him, like you, can actually get done what he promised to get done, which is get control of this virus.
Yeah. Well, I mean, I don't think we need to convince each other that we are going through a historically challenging time with a pandemic that thus far has taken about 430,000 lives in the United States of America and continues to threaten to take thousands and thousands more. We have some light at the end of the tunnel, the idea that we have at least 2 highly efficacious vaccines. And as you're probably going to be hearing over the next few days, even more that are lined up that will likely look very good. The only message I could say is, and I mean this sincerely, that the educational community, the teachers and the teams associated with education are such an absolutely critical part of society in general, but also a very critical part of our response to this outbreak, because we're not going to get back to normal until we get the children back in school, both for the good of the children, for the good of the parents, and for the good of the community. But we want to make sure we do that by giving the teachers and the team associated with the teachers the resources that they need to do that. The idea of saying, go do it on your own, that doesn't work. And that's the reason why President Biden has been very clear about how he wants the American Rescue Plan to get through and to be implemented. So I want to close with just a really big thank you. We have people in society who emerge during outbreaks as heroes and heroines. Certainly the healthcare providers who are out there risking their lives, risking their safety, working tirelessly to take care of people, just deserve all of the praise and credit in the world. But also the teachers and the team that takes care of our children's well-being, their education, trying to keep them safe. I mean, I think that you all are a bunch of heroes as much as anybody else. So thank you very much. I appreciate it. And I'll be happy to meet with you anytime you want.
Oh, we're recording this, Dr. Fauci.
We're holding you to that. Thank you so much, Dr. Fauci. And I want to thank Becky Pringle for doing this with, the NEA and the AFT together, having this fireside chat with you, and just promise us we will be safe and be well.
Thank you very much, Randy. Thank you, Becky. Good to be with you.
Dr. Fauci.